Welcome to Leaving Nothing to Chance, your go-to podcast where we bring you insights from some of the most influential voices in small business and personal development. Each week, we dive deep into conversations with top thought leaders, authors, and business moguls from around the world, sharing their secrets to success and strategies for growth. Tune in for exclusive content that will inspire, motivate, and equip you to take your journey to the next level. This is Leaving Nothing to Chance.
Today, we're visiting with a new friend of the show, Dr. Carl Rothschild. But for our purposes, we'll just call you Dr. Carl today. How are you, Doctor?
I'm doing great. Thank you for asking.
And we were just visiting, and we realized we're from the same neck of the woods, as they say, the New York, New Jersey neck of the woods.
Absolutely.
Even though we both had enough sense to leave.
Okay, we may have some New Yorkers that are listening, so we might edit that out.
My sister's a proud New Yorker. She listens to all my shows. So
both of my brothers love New York. I love New York to visit, but they live there.
I have to admit, I'm still a diehard Yankee fan, and living in Dallas, every time that the Yankees are down here, I go to the ballpark. The Giants, some years I go, some years I don't, but still haven't lost my passion for the New York sports. But you started out life as a chiropractor way back 1978. I think you relocated to California.
I relocated in 75, went to chiropractic school out here. After going to Stony Brook University out in New York, which is actually pretty decent. It's like the UCLA of New York system. And then I just decided that I wanted to do something different. And I researched chiropractic, and I decided to go to the best school at the time, was in California. And so I traveled all the ways out to Los Angeles, and I graduated in 1978 and opened up my practice right around that time. And it's been wonderful ever since.
And red light therapy, how did you first learn about it?
A great question. So it was about 26 years ago, there was a gentleman, his name was Chadwick Smith. He was a medical doctor out of USC, and he was a professor and a big shot orthopedist, and he was bringing red light to the United States. And he said, yeah, if you shine a light, blah, blah, blah. I said, in my mind, I'm thinking, at that time, I'd been in practice for about 20 years, and I figured I knew everything. So what's he talking about? I'm going to shine a light on somebody. It's going to make a difference. And I really I could have been part of even earlier on, but it didn't take long before I finally decided, okay, let's go along with this. And it revolutionized my practice. I had a device back then, it was the only one that we started with. Nobody else had red light for humans. They had it for pets, but not for humans. And that was, as I said, about 26 something years ago. And I was able to heal things I couldn't believe. Like this lady would come to me and say, I have gum disease. Could you help me? I had no idea. But one thing we knew is that you couldn't hurt anybody. What's the worst that'll happen is nothing. So we tried it on a whole bunch of different things. I helped her gum disease. I helped this guy with his kidney problems. I helped that guy with shoulder issues. We helped this person who had a ripped Achilles tendon and was going to have surgery. And by the time I was done with him in 1 week, he didn't need surgery. And that was with a device that was so much weaker. At the time, that was the state of the art, but so much weaker than what we have today. It's ridiculous. Thousands of times more powerful. And that's the process. You want more power, you want more penetration, and that made a huge difference. Then about 13 years ago, give or take, maybe a little bit longer, we discovered that there was an element of red light that actually helped with fat loss. And I've been working with my patients on fat loss, and some people, it's just very difficult. In some cases, they're obsessed with food. In some cases, there are some myriad of issues why somebody might not be able to lose the weight. And I figured if I could put something and use something that's natural, that's not poisonous, there's no side effects. In fact, in the 50 years that this technology has been studied, there's never been a recorded side effect. But what we found is that you can shrink fat cells, but not damage the cells at all. You're not freezing them, boiling them, lasering them. You're not doing anything. It's just releasing the fat into the tissue, into the surrounding tissue. And with our protocol, we move that fat away from the fat cells and eventually to the liver for use or elimination. And it works. So that's when I decided to get involved with manufacturing. I said, this is something powerful, and I really wanted to get more involved. So that was about 13 something years ago. And then when we're going along, and yes, every year coming out with something stronger, more effective, whatever. And then something happened to all of us called COVID. And my practitioners wanted less physical contact between the patient and themselves. Otherwise, they wouldn't be able to stay open. And the bed was the perfect answer for that. With the bed, you don't need staff. You get into the bed, you get out of the bed. It's easy as pie. And it was just going to be a substitute for what we were building up to that point, which was we were involved with lasers and we were involved with pads that went around the body. But within a month of us having delivered our first series of beds, we were starting to get feedback that was unbelievable. And what we have since learned is that when you penetrate and bathe the whole body at the same time, different from just doing a laser over the elbow or a pad around the various parts of the body, but when you bathe the entire body at the same time, that's when we're seeing results that we never, ever expected. And so, for example, when a lot of times when I do my talks, I start early on with this question. Pretend that you're a health provider, or if you are a health provider, you don't have to pretend, but no matter what, if somebody called you up and said, I'm having a heart attack once, if not twice a week, and I've been having them for 12 years, and they're getting worse. And by the time we saw this person, they were on their last leg. If you want to kill off a part of your body, restrict blood flow. His blood flow was miserable to all parts of his body, and he had no energy, and everything on him was starting to fade, so to speak. And the doctor calls me up and says, should I even treat this guy? I don't want to. What if he has a heart attack in my place? I said, just treat him for 5 minutes and stay in the room the whole time. So that patient goes home that night after that first initial treatment, and it changed his life. He couldn't believe the energy that he had. And by the end of the second week, everything was coming back to life, coming back to normal. And that was well over a year and a half ago. And since that first visit, he's not had another heart attack, not a one. And this is just one of many examples. And this is why red light is exploding. When he started it, there was just a few guys doing it, and now it is huge. Unfortunately, sometimes when something gets huge, there are people out there that are going to create knockoff junk and pretend like it's just as good as anything else. And then when people use that equipment that doesn't work nearly as well, they go, I tried it, it didn't work. But the truth of the matter is, I don't care what your problem is. If you haven't tried red light therapy, that's a huge mistake. At least just do 2 weeks of 3 times a week. That's 6 visits. And at the end of the 6 visits, I would be really surprised if you didn't notice any difference. You might need a lot more treatment, maybe not. But I would be really surprised if you didn't notice significant, at least some change. So we had a lady that had a stroke. And after 8 visits, she was better than she was before she ever had a stroke. We had a guy, his name is Joey. He was the first one that I really knew something was up. This was years ago. And he said, so originally he had what's called Charcot-Marie tooth disease, which is an autoimmune disease, which meant that he was 15 years in pain every day, could barely walk and didn't walk because it was too painful. And after 6 visits, he's on the treadmill, walking. He walked his dog for that dog's first time ever. Huh. These people are seeing him in the neighborhood. And he was the first one, since we had created the bed, that looked the doctor in the eye and said, and I want to thank you for giving me my life back. And why do you think I became a chiropractor 40-something years ago? It was because, it wasn't about money, although I don't mind making money. I love the idea of helping people. And when people are looking you in the eye and saying, thank you for giving me my life back, that's it. That's that's it. Money, okay, fine. But man, could you imagine what that feels like? And now we're hearing it regularly. I heard it as a chiropractor. I heard it. Don't get me wrong. But it was occasionally. Now we're hearing it all the time.
Now, let me ask you about some specifics, Doc. TBIs. I'm hearing great things about TBIs.
Oh, absolutely. Traumatic brain injury. So, first of all, if you put your finger on the top of your head, work it all the way to the bottom of your feet, and think of anything in between, most likely red light's going to be able to help you.
Okay.
Now, there's some variations on that. I tell people, look, if you lost a finger, probably not going to grow that finger back. Definitely not going to grow the finger back. But other than that, there are a lot of things that we're just seeing great results with. And so with traumatic brain injury, with anything related to that, brain issues, we had a lady, I'll get back to TBI in a second, but we had a lady who had really terrible tremors from her Parkinson's. That was a big complaint, was that she couldn't hold the Bible in church, and it was embarrassing to her. That was, even though she had many other symptoms, that was her big disability, so to speak. And within 2 weeks, the tremors, they were still there, but they were so much milder that she was easily able to hold the Bible. So brain issues, neurological issues, multiple sclerosis. We had a guy who I know of who was having every time he went, every 6 months, it's a progressive kind of, it's in its nature, it's progressive. And every 6 months, you're going to get worse, and you're going to get worse, and you're going to get worse. And after 6 months of getting red light therapy, he went back to the neurologist, and the guy couldn't believe it. It halted the progression completely, and most of his symptoms were gone. So and it's difficult. That's a more difficult case, but even multiple sclerosis. We had a lady with 16 really bad conditions, 16. And I counted off as I interviewed her, because her big complaint when she emailed me was about Lyme disease. And when I found out that was just one of the many things that were problematic for her. And we can talk about that later. But after interviewing her and doing the testimony, it was just unbelievable. Everything's gone. She doesn't have any of those issues. She doesn't need to take the drugs for all that. She doesn't have to go to the cardiologist, the thyroid expert. She had horrible autoimmune. She had psoriatic arthritis, psoriasis, and plaque psoriasis, and they're all resolved, everything. Anyhow, getting back to TBI, we have football players, in particular, also after collisions and stuff, but we have more contact with sports injuries, and we've seen very nice results with people, and even PTSD. So we're getting post-traumatic guys from the war, although that's a challenge getting in through there's a lot of bureaucracy sometimes when you're dealing with different organizations. But if you're a vet and you have those kind of issues and you're not getting in our bed, that's a mistake. Just 6 visits, try 6 visits, and you'll see a difference. And then later on, what I can tell you now is that if you went to our website, which is trifectalight.com, and went to the section that's locations, either find a doctor or something like that, I forget what it's called, and just put in the information, mention that you met me here, at the podcast, and we'll find you a location to go to, because there are going to be 2 kinds of people out there. There are 3 kinds, I should say. One of you just wants to get treatment. I recommend that. Another one of you has more money than health, and you want to buy it for your home. And the third one of you are people that recognize that this could help your business or start a new business, but even better, help the business that you have. Because if you're on this side of the fence and you don't have the red light, and you have a twin on the other side of the fence and they do have the red light, they're going to put you out of business. Everything else being equal, you can't compete if you don't have a red light bed. That's my opinion. And again, there are all these other contraptions out there. I know on the wall, there's red light. On whatever, there's all kinds of the panels and whatever. And I've worked with all of that. But it wasn't until we, as I tell you, we bathe the entire body at the same time. That's the critical thing. And having the lights very close to the body. So if it's 10 feet away from you or 6 inches away from you, we're talking about right on your body. As you come away from the body, you lose power exponentially. You want the lights as close as possible. In order to do that, you have to have what they call efficient lights. That means the lights are really strong, but not hot. Heat is the enemy. Heat is the absolute enemy. I just was asked What about sauna and red light therapy? It's ridiculous. They work against each other, because on one hand, you've got our lights that you don't want heat. What does heat do? It dilates blood vessels, brings more fluid to the surface, and that will absolutely block the penetration of the light. You don't want that. So when we first came out with lights 26, 27 years ago, we called it cold laser. And they weren't literally cold, but they didn't get hot. And that was to distinguish it from the hot lasers that burn and cut, because we want to be under the radar. You want to have real strength, but you don't want the body reacting so that all that fluid gets in the way and you don't get deep penetration. By keeping the lights cooler and getting that deep penetration, that's when you're getting these kind of results. Full body, deep penetration with lights that are very close to your body. There are other factors, but those three are very critical. So I also welcome your audience. I do not make a dime off of this, but I did write the book. It's called Illuminated Healing. And I get very good feedback about it. So if you get a chance to read that book, it's 280 pages, put a lot of work into it. I did have some assistance with that, I will admit. I'm not the greatest writer. I'm a good writer. I'm not the greatest. So I had an editor to help me to smooth out the edges and make it sing. It reads very well. You can get it on Audible and listen to me for 8.5 hours, or you can get it on Kindle and you can read it on the computer or your laptop or whatever. But you can also buy the hard copy book.
Can you get it on Amazon also?
That's the only place you're going to get it, is on Amazon.
Great.
Amazon will lead you to Audible. I think they own audible.com. So I'm not sure.
When we're wrapped up here, I'll give you my address. If you send me a copy, I have a show on Wednesdays where I actually interview authors, and I take about 3 or 4 chapters of their book and I break them down. So I'll give you the details of that, not to take everybody's time now, but it's exactly what we're doing, is taking books and saying, hey, we got to get people reading again in this country. That's how you get smart. You got to read. Or it's fine too.
So what you can do is just email me your contact information and I'll send a book to you.
Great. And then
that's a really smooth way of getting a free book from me. I like that.
Hey, it's good. My library is growing. It's amazing.
My pleasure.
You know, the tough part when you do a lot of podcasts is a lot of people have written a book. So it's you do get a stack. But what I do is I do a couple of chapters and I break it down. The first one I did, the guy wrote a book on a number of different famous people like Abe Lincoln and Mary Kay and Walt Disney. And so we broke it down. Now the next one we're doing is on I am statements, right? So that one's a few chapters. Then I got another guy who's a buddy of mine that wrote a book on finance. But anyway, we're always looking for books and topics. And then at the end, when we're all done, after everybody listens for a few weeks, then we have a live call like this where they can say, hey, Doc, what about this? What about that? Anyway, we'll come back to that. But
listen, if I send you a book, I'm going to quiz you on it. So you better read the damn
Oh,
thing.
believe me, I do, because I'm asking you the questions on the interviews. So don't worry, I'll read. Anyway, so let's stay on the topic, though. Let's talk about performance, because I'm an old athlete. I got all the aches and pains and the injuries now. But how about the young guys? How about the young women? How about the figure skaters, the hockey players, the wrestlers, the football players, the et cetera? How does red light?
Great question. So I'm excited to tell you, I'm sorry I'm interrupting you. This is a critical part of our company. It's called Performance and Recovery. And the reason why we had a bed at the Olympic Training Center near Seattle, Washington, and this was for field and track. And I can send you some videos that I interviewed a professional pole vaulter. And what she described and what I explained to her, what I suggested is that you get in the bed in the morning, and then your performance that day, whether it's their 8-hour grueling workout or they're actually competing, you get in the bed in the morning, you're going to compete or you're going to perform much better that day. And then you get in the next night, that same night, and you're going to recover much quicker. So when you wake up the next morning, where normally these guys would be exhausted, sore from the day before, they're fresh, as they called, fresh as a daisy. They can't wait to get. So we have professional basketball players, we have football players. In fact, one of the guys, and TBI, I will say, is more involved. Whereas as somebody could, like I told you with the heart thing, that responded unbelievably quickly. But when we notice anything to do with the nerve and the brain, it takes longer. Every tissue in your body heals decently except brain and nerves. So if you sever a nerve, that's it. You can break a bone and it'll heal. You can cut your skin. You can do different weird things to your organs and glands, but brain and nervous system are challenging. And so it takes longer. So what we've noticed with any kind of brain kind of involvement, that they don't respond as quickly, but they respond. And so it might take longer, but who cares? You know, you're getting a natural way. By the way, this is all natural. We're not putting anything in the body that doesn't belong there. We're not taking anything out of the body that does belong there. I'm a chiropractor. We don't believe, as a rule, surgery and drugs are the last resort, not the first thing to go for in general. And that's why chiropractors have always been in trouble with big pharma, because they don't like us. And I don't blame them. We would, if everybody listened to me, that would be dumb. But if everybody listened to me, there would be a lot less drug use. There would be a tremendous decrease in hospital stays. If everyone got in the bed 3 times a week for the rest of their life. I'm 72 years old, and you got to believe I'm going to be getting in that bed 3 times a week for the rest of my life, as I have been for years now. I love it. But at any rate,
well, you certainly don't look your age, doctor, and you got a tremendous amount of energy every time that we talk. That's the greatest endorsement for any product, right? Is the people who develop it and use it. So let's stay on that though for a minute, because we're talking about TBIs. We're talking about.
Just wanted to finish on performance and recovery, just real quick. So we were at the pole vaulter. So I'm going to get you those videos, but she was able to perform and do everything so much better. Her name is 𝐂𝐎𝐍𝐉𝐎𝐾. And her father runs that. He's one of the main Olympic trainers for the United States field and track. And so he's interviewed as well. And I'd like to get you those interviews. You can look at them yourself and then distribute whatever you think would be worthwhile. There's the one about the person that had 16 different issues, including all that psoriasis and Lyme disease and kidney problems and all kinds of issues. In fact, with this one woman, she also had uveitis, which is swelling in one of her eyes, which was outrageous. Normally, the pressure should be around 10, and her pressure was 180. And after just a short period of time, it went back to 10. But before that, before she got involved with red light therapy, you want to guess what the treatment was? It was injections in her eye once a month. And she described, I said, foolishly, I said, what was that like, getting injections in the eye? And it's like, how do you explain the biggest horror you could think of? You got this needle coming into your eye, and they charge $5,000 per injection once a month, and she doesn't need that anymore.
Wow.
We're not making friends in the pharmaceutical industry.
No.
So maybe you shouldn't play this.
Oh, no. Hey, believe me, we're all on the same page. Thank God now we got some responsible people in our health department. But let's stay on that subject, because one of the things that occurs to me, I'll be 64 in May. And you mentioned MS before. I lost a very dear friend in Pittsburgh from MS about 2 years ago now. We think about like our parents or grandparents, well, probably more our grandparents at our age, maybe even parents at some of the younger people listening to the show's age. Our grandparents and great-grandparents, they traditionally died of what? Cancer, heart disease, or what they called old age. Their grandpa just got old, he didn't wake up one morning, probably had a heart attack. And we still hear that, but because we're living longer, because of modern medicine, because of exercise, because people aren't smoking as much, there's a lot of people, not everybody, but a lot of people like yourself and myself, taking care of yourself. We're more aware, perhaps, than grandpa or grandma were about all these health things. So the question is this, doctor: neurodegenerative diseases, things like your Parkinson's, your Alzheimer's, your dementias, your other brain-related diseases, right, which are linked sometimes from when you were a kid, when you got concussed playing ball, or you fell out of a tree, or you fell off your bicycle, or whatever, manifest themselves as we get older. And to me, there's nothing more tragic than to see an otherwise reasonably healthy human being. Maybe they can still walk, they're still ambulatory, they're still able to get around, but they see their son or their daughter or their grandkid and they go, who are you? So along those lines, what's been the results in your experience so far with treating or helping those people? I don't know if treating can be applied to this or not, if FDA listens, but helping people with those
You
type
can use the word treating, you just stay away from curing. So yeah, so from one early on, remember I told you that we had this one guy, he had the Charcot-Marie tooth disease, couldn't walk, and now he's walking. Around that same, about a week later, I got a communication with a woman whose mother had severe dementia and horrible Parkinson's, and they couldn't handle her at home anymore. She was belligerent. She might hurt. She was a danger to herself and others, and they were going to have to put her in a home. But she said, I'm going to try this one last thing, and she got one of our beds. And within 2 weeks, the Parkinson's was much better. And by the end of the first month, that woman was so much more, she's still an 85-year-old, ailing, fragile human, but her quality of life was so much better that she was able to get in and out of the bed herself. Up to that point, they had to carry her and hold her in. She was able to get out easily, and eventually even getting in the bed was much easier. But the dementia was what was really striking, was that she was lucid now and she could actually communicate with no problem. Again, I'm going to tell you, number one, don't wait until you have these diseases. If you take care of yourself today, you'll have less problems later on. This is what happened to me, okay? I'm a chiropractor, started in 78, and I was a kid. And I looked, if you think I look young now, when I was 25, 27 years old, I must have looked like I was still in high school. Right. And so the patients would treat me sometimes like a kid, but it was unbelievable how scared I was, because in my mind, I would say, I hope I don't wind up like that. And these are people that didn't take care of themselves. And they don't, so I got scared out of my mind. In the first year, within that year, I had so many people that, and men, they're going to a chiropractor, so they're not the normal percentage of humans in this country. They're taking even better care of themselves, and they still are a mess. It's not about waiting until you're a mess to finally take care of yourself. Now is the time to try to prevent these things. And it comes down to there's certain habits that people have. And it's not complicated. It does come down to how much you care about yourself, but mostly it's about how scared are you about winding up like that. I was scared out of my mind. So I started I was pretty healthy up to that point. I started doing even better with my exercise, better with my eating. So staying away from starchy carbohydrates, simple sugars, sodas, and alcohol are a key element. I never was into drugs or anything like that. No one's injecting anything into my body at this point. And the smarter you can be about taking care of yourself, the better. You don't have to do it all in one step, but decide on a couple of things that you're going to do better and then add to that and add to that. But don't wait until you're like that. And in my mind, so let me tell you how this works and why this works so wonderful preventatively. You know what this red light therapy is all about? It's about sunlight. It's about taking the 4 healthy, incredible wavelengths of sunlight. And there are many wavelengths. We've isolated the 4 with the research to know the exact 4 that are perfect for you as an individual. And so you're going to have these 4 unbelievably miraculous wavelengths of healing light. Now the sun does a good job. Now imagine taking 4 of those elements, magnifying them many times, and driving it deep into somebody's body. Again, remember, in the 50 years of technology, studying this technology, there's never been a recorded side effect. Never. Again, the worst that you can do with anybody is nothing. And that rarely ever happens. Even the people think, I'm great. After they get out of bed, they're going to say, I thought I was great, but now I'm sleeping better. My digestion's better. I have less cloudiness, where I can have better clearing my brain. Just so many different things. And the skin is going to look phenomenal. I'm talking about fine lines and wrinkles, but anything you can think on the skin is going to look fantastic. Just great. Wrinkles, fine lines, and stretch marks, and sagging skin, and whatever. Great improvement with all of that. So if you're not getting in if you're not doing red light therapy 3 times a week now, you're making a mistake. And you might want to get into the best equipment possible. And that's what I've done. I've spent many years developing the most powerful bed, but power without heat is the critical element. We could have had that much power, the amount of power we have now, we could have had it 26 years ago. But not only would we have killed the patient because it was so hot, but even if we weren't killing the patient, it was so hot, that heat would be outrageous. Now we can have a lot of power. That's unbelievable power without the heat. So that's a critical thing that you need to remind yourself about. So get in the bed. That's why the staff made this for me. Can you read that?
Get in the bed. Yeah.
I know my craziness. I said, just get in the bed. That's it. That's all you have to do 6 times, 3 times a week for 2 weeks, and you will see if this works for you. It's pretty rare that it doesn't help. So that lady that was getting the injections in the eye, she only did, I think in 2 weeks, it went from, certainly within a month, the uveitis that was 180 pressure went down to 10. And now she didn't need those injections in her eye. And then she also had horrific floaters in her eye. Those were gone. In fact, people say, when I get in bed, should I keep my eyes open? Should I wear goggles? Blah, blah, blah. If you wear the goggles, you're not going to get this miraculous energy into your eye. So just keep your eyes closed. It's not dangerous. So if you open your eyes, it's just a very bright light. I don't know how many of you want to stare into a very bright light. So just keep your eyes closed. And if I'm telling you, it can get through your skull to get to your brain, you can get through your skin to get to any organ, gland, pretty much any structure in your body. We've seen results with all kinds of elements of the body. They just keep their eyes closed, and things that happen in the eye are beautiful. We've heard of macular degeneration, macular edema, uveitis, as I described, glaucoma, floaters for sure. And then while the person gets in the bed with their eyes closed, they keep their mouth open. Imagine this unbelievable, miraculous energy getting into the mouth, sure, getting to the throat, the tongue, gum disease, all kinds of stuff. It's exciting.
You have a great statement on your page. I just want to quote this because I think it's exactly what we're talking about here. The best time to take care of my health was 20 years ago. The second best time is now. I love it. I'm gonna steal that one from you, by the way.
You can have it.
I'll quote you though. I said Dr. Carl told me this one, but along those lines. So let's talk about that for a second, Doc. So somebody hears our show, they're not in great health. They've got whatever, because everybody's got something, right? Or some things, unfortunately, these days. What's their first step? They've never used red light before. Maybe this is the first time they're hearing about it. It's obviously a biohack that's become extremely popular, but it's become popular to guys like you and I. This is the world we kind of gravitate towards. But they're a real estate salesman. They're a life insurance salesman. They're a whatever. And so they're not in the health world. So they've heard about it, but they don't know what it really is.
All they need to do is to go to the website, trifectalight.com. There's a lot of information there. In fact, there's on the bottom of the first page, there's our YouTube channel. Oh my God, there's over 100 videos. A lot of them with me, a lot of them with all kinds of different, very famous healers. And we'll be getting more because this thing's just growing exponentially. So you go to the website, but you also can try it. We have hundreds of locations throughout the country. And all you have to do is, you'll see where it says find a location or something like that. And then just put in there, again, that you came from this show. So we're going to do our best to get you the first visit free. And if you're interested in buying it, we'll make sure that you get a discount as well.
Great. Listen, you can't do better than free. And I know I live in a big metroplex, so I'm sure there's somebody probably within 15 minutes of my house. What about the person maybe lives out in a rural area that doesn't have as much access to a big city?
We got beds all over the place. And you're right, there are areas that we don't have a bed near you. So I don't know what to tell you. What I'm going to tell you is that here are some of the options. Help us bring a bed into your community, or you buy a bed. If you have more wealth than health, get the damn bed, because I'm telling you, it will change your life. If I'm going to buy a fancy car that costs hundreds of thousands, whatever, a lot of money, I probably should try it first. And I'd be willing to travel 200 miles to try it, see what it's like. Is it scary? Is it whatever? It's a very simple thing. And people get addicted to it in a good, healthy way, like I do. It's great for energy, it's great for your well-being. But most importantly, what you want to do is get healthy now and don't wait until it's too late. There is going to become a time when there's nothing that can be done. I don't care whether it's red light, surgery, drugs. There are times, if you let this go, I'm telling you, take care of yourself starting today. If you have no symptoms, that's perfect. That's when you should start. But if you have symptoms, start. There's no wrong time to start. Start. That's my opinion.
Great advice. Great advice. Let me ask you this, Doc. You've been a doctor since 70, what did you say, 78?
78.
Whatever that is, a while ago. I was in high school.
47 years ago, 46 years ago.
It's hard to believe. I was in high school then, but it's a long time ago. But
you don't have to keep reminding me how old I am. Thanks a lot.
I'm right behind you. I keep getting my Social Security thing. I'm 3 months from my birthday, so they keep mailing this thing to me every year, and I keep saying, "Who is this old guy's information?" Who's this?
Look, when I went to the doctor's office, they have your name, and then they have a description, and they wrote elderly man. That was me. It's just the word. I don't like that word, elderly.
I'm with you. So let me ask you this, though. And the reason I asked that question is, okay, so you started at a time when even chiropractic was like voodoo. It was like, oh,
it was very controversial.
Yeah. Today, it's like most people, as a matter of fact, a lot of good doctors, a lot of good MDs that I know, like I deal like you do, both sides of the aisle, the traditional allopathic guys and the holistic guys in my regular business and with the podcast, of course. So really two questions. One is, how have you seen that morph? Because like this biohacking terminology, which red light, I think it would qualify methylene blue, what I do with glutathione, what others do with some of the alternative therapies. Of course, Wim Hof has become so big with cold water therapy, etc. Right? These things that at one time people said, my doctor didn't tell me that, so I'm not going to do it. How have you seen all of a sudden people's acceptance, if you will, of saying, you know what, I don't know if that's going to work for me, but at least let me try it. To your point about the red light, hey, it can't hurt you. We've got no side effects.
Exactly.
Have people changed, or has the information changed where people are saying, hey, let me try it. What the heck? What I got to lose?
People have changed, and I'll tell you how they've changed. They started realizing that your doctor doesn't know everything. They started realizing that, listen, I was at a meeting, right? Now, I know nutrition 10 times better. Let's just say this medical doctor who is a friend of mine, but his name was John, and John was sitting across from me. And I said, milk's not great for everybody. And you probably shouldn't have milk unless you test it out and check it out. There was 25% of the population should be anywhere near milk. And there are doctors that say 100% of people shouldn't be anywhere near milk because milk is the perfect food for a cow's baby, calf, not for humans. But I didn't go that far. I just said there are some people, about 25% of the population, that really suffer when they have milk in their diet. And he went all over the place about telling me how I don't know what I'm talking about, blah, blah. Now remember, he doesn't know nutrition at all. And yet everybody at the table listened to him, not me. I was okay with that. I figured that out. I'm used to it. But it was just a matter of everyone revering that MD, who, by the way, a lot of them are great, but some of them don't know anything about certain things, especially about diet, nutrition. They're about managing your problem. They wait until you're half dead, and then they're going to manage that with what is the right drug and what is the right surgery. And again, sometimes drugs and surgery are absolutely perfect answer, but I'm very much interested in trying other things first. And nothing else works. Thank God we have surgeons. Thank God we have drugs that will help people when nothing else will help.
I'll give you
Did I answer your question?
I have a second question, but perfect example of that. I hurt my shoulder lifting weights about 8 years ago. The first doctor I went to was a very well-known orthopedist here in Dallas. He said, shoulder replacement surgery, I don't do that. Gave me a card of another guy. He said, you got to go see this guy.
Oh my God.
Driving home at the time, I'm like, I had a buddy who played for the Green Bay Packers. He had his shoulder replaced, still can't get it past here. So I'm like, I need my shoulder not only to work out, I need my shoulder for a lot of other things in my life.
Scratch your head.
So I went to another orthopedist, okay? And that guy said, well, let's slow down. Let's try this. Let's try this. Let's try this. Eventually, I had the stem cell shots, and my shoulder's far from perfect. But at the end of the day, I'm fully functional. I can lift weights. I can throw a shot put and discus. Okay. Not well, but I can at least participate with my friends in those activities that I enjoy.
If you combine stem cell with red light therapy, that is glorious.
That's my,
a lot of guys doing that.
that was my next question, is the combination of these things are so powerful. But let me ask this another way, Doc. We have a lot of doctors listen to the show, all different types, as you can imagine, right? Because we're associated with Top Doc. We work with John and the guys at Top Docs. We have a lot of docs listening, a lot of docs I'm interviewing for that matter. Anyway, and in my professional life, I work with a lot of doctors from different things. So we got, I don't know, probably a couple hundred of them that listen to the show. So they say, you know what? I'm sold on red light, but I don't have it as part of my practice yet. What's your advice to them? How do they get started to say, hey, this is something we should incorporate into our practice? Be they traditional doc, chiro, or any of the other pursuits that are out there in the medical field, or for that matter, massage therapy, all the different applied sciences, if you will. How do they get started?
What I would do is I would send my clients to a nearby facility that had our bed before they bought one, if they want to weigh it. I know in my heart and my soul that they need my bed. They need it. That's it. Answer, question, done. But not everybody is as nutty as I am, and they don't know what I know. So you take baby steps. I know that if you don't have that bed now, it's not how much it costs, it's an investment, and it will return literally at minimum 10 times return on investment that we're seeing with our practitioners. But absent that, there's also the glory of having people telling you that you've helped them like nobody else has. If you would have combined stem cell with the red light, your shoulder would have been that much better.
Agreed.
And the reason why I believe in full body as opposed to just little areas of red light is because as a holistic doctor, for example, if someone came in with an elbow problem, I'm not only going to work on their elbow, I'm going to make sure the entire nervous system is also supporting this. So we're working on the neck and the back and the nerves down to the elbow. So doing full body, you're covering everything that's possible. And then all of a sudden, they're going to also tell you about things they didn't even think about and how much better they're doing in that area as well. Like clarity, like sleep, being able to sleep much better, and all these other things. Did I answer your question?
That's a great answer, because like I know, for example, the chiropractor that I go to here in Frisco, Texas, over the last 5 years or so that I've gone there, he's brought in an MD that does the stem cells, for example, once a week, right? Because a chiropractor can't give the shot, but an MD can. So he's got that association with a traditional member of the AMA with a chiropractor. And as you know better than I do, there was a time those two people wouldn't even, they wouldn't even be in the same room. Now they're saying, hey, to your point, I don't have all the answers. I got these answers. You got these answers. Let's put them together.
Correct.
And help the patient, most importantly. And then the patient winds up coming back on a long-term basis, because there is a business side to this stuff, as we both know. But anyway, so I've seen that, and he's incorporated some other stuff. But in talking to so many docs, especially after COVID, where the business got harder, right, financially, they need that edge. And once again, if a patient goes, wait, I got to go down there for red light, but I got to go over there for this and over there for that. Whereas if they come to a facility, a healthcare facility, and red lights included, it just makes sense, because it seems to make everything else work that much better. Is that a fair statement?
Absolutely. Absolutely. And there's several divisions. So there's the aesthetic world. It helps with the skin and hair restoration and things like that. And then there's the health world with musculoskeletal issues and internal organs and all that sort of stuff. But then there's also the emotional and psychological issues, which we've tied in with some of these PTSD and some of the BTI and issues like that. So I had a lady, she wrote me an email. She said, if this is how normal people feel, I can't believe I've been missing out all this time. She was, for many years in her life, so highly depressed, almost suicidal, but she hated her life, wasn't functioning well. And after a very short time using the red light, it changed everything for her. and her life, quality of life, that's what this is all about, got much better. And that's what happened with this guy who had Lyme disease for 40 years. He contracted Lyme disease when he was 12. We didn't meet him until he was in his 50s. And he was very depressed. His energy was gone over these 40 years. It ruined his childhood. It ruined his social life. It ruined his education, and it destroyed his career or career potentials. And here he is in his 50s. He gets in the bed, and I'm going to send you this video. It's earth shattering what he says about how it's changed his life. But the first thing he says is, I got out of the bed after that first time and I didn't notice any difference. And so I dismissed it. But then 5 hours later, and ever since, it's changed my life. It's incredible. Look I wasn't expecting these things, by the way. When we first made the bed, we were just thinking, okay, this is instead of what we were doing up to that point because of COVID, we thought it would be good. We didn't expect the kind of things that we're getting. And every day, this guy over here had Leber's hereditary optic neuropathy. I hadn't heard of that before. And essentially, it sounds a lot like multiple sclerosis of the retina. So it's like a cavity eating away at his eyesight. So by the time we met him, he was at 50% vision and he was going to go blind. It was a guarantee. There was nothing anyone could do. That included migraines and other headaches, and he couldn't sleep and all kinds of stuff. And within 2 weeks, we halted the progression of his issue. So he's still at 50%, but he's not going to go completely blind. And all the symptoms seem to disappear, like the headache and the lack of sleep and all that sort of stuff. I didn't expect this. None of us did. So you could see, I think if I was expecting, I wouldn't be as crazy as I am. I'm so ecstatic about the kind of results that we hear. And I get new ones every day.
Yep.
Every day, new things. You didn't tell me. They'll go, you didn't tell me it could heal that. I didn't know it could heal that. I'm not supposed to use the word heal or cure. I didn't know I could treat that, but we treat them.
Great. So Doc, just in wrapping up, okay, so people want more information, trifectalight.com. Is that the best place to reach you?
Best one, yeah.
Great. I got to tell you, because I've used red light just like you say here and here on specific things. I've got some little units, but I am going to go to your website and I'm going to find a place locally here in Dallas. And I'm going to
send me your address anyhow, because I'm going to send you the book that you're going to study inside and out.
believe me, when I interview people and I ask them questions, they go, you really did read it? I'm like, yeah.
Remember that there's 2 parts to my book. And one of the parts is the research. And I didn't do all the research, to be honest. I had help with that. So if you ask me about the research, I may or may not be able to answer. But all the technical and clinical aspects of the book, if you want to know about red light therapy, this is a phenomenal way of learning about it. It's called, again, Illuminated Healing. I did not make a penny from this.
Just so you're prepared, my friend Dr. Jimmy Gutman, who's head of research for our company, he's a McGill guy, and he said to me one day, he goes, you are a pain in I forget the term he used, but it was a Yiddish term. He goes, you're basically a pain in the ass. He says, because for a layman, nobody asked me more sophisticated medical questions. He goes, I have doctors don't ask me what you ask me. He goes, how do you figure this stuff out? I go, so I read the research with a highlighter and I have no idea what it is. And then I Google it and I get an idea what it is. And then I ask you and I really confuse the what out of you. And I promise I won't be that thorough with that, Doc. But this has been fascinating. It's been fun. And we should do it on a regular basis every few months, because this isn't going anywhere. I agree with you 1,000%. Every time I turn around, I'm seeing more red light. And I'll tell you a fast story. I love your reaction in closing. I have a friend, Sean Finnegan. I'm going to name him by name. I told him I was going to do this today. Sean's 75, just turned 75. World-class powerlifter, by the way. First man in history to document it, and I was there when he did it, bench press over 600 in his 60s. Fast forward a few years. Now, Sean had a terrible diet. He since has cleaned it up. But from New Orleans originally, ate all the heavy foods they eat over there. And he has a massive heart attack. And we thought we lost him. And they do quadruple bypass, cut him open, do all the stuff, fix him up. He's back lifting weights. And the gym he goes to has the full red light therapy. He's like a new guy. So he's in every Sunday I see him, and every Sunday he's telling everybody in the place, because we're all older guys, we hang out together, lift weights together on Sunday. He's like, every one of you guys needs to start doing red light. So I said, I'm interviewing a guy who's an expert in red light, so he'll be listening to the interview and hear his name. But to that point, Doc, you've seen so many people come back from some of those serious things like Sean had using this red light stuff. So I get your enthusiasm for it, but your advice to anybody who maybe has given up on their health and they just think, okay, it's just a question of time. Obviously, I know what you're going to say. Get there and get the 6 sessions, but what else should they do?
If you find a practitioner that you have faith and trust in, who has your health in mind and not just how much money they can get from you, and combine that with red light, you want guidance. We all need a coach, whether it's a coach on your business or a coach in your health. Your doctor should be your coach. That doctor should be guiding you, helping you, figuring out what's best for you. It could be a naturopath, it could be a chiropractor. There are some holistic medical doctors, but somebody that's approach is more holistic, not first thing taking, we'll take this drug and then that drug and do this surgery and that surgery, but somebody that really cares about your well-being. That's what you want in combination with smart red light therapy. I had this desire to help people. So I didn't care and didn't want to know what kind of case it was. In other words, if they were Medicare, maybe they would pay less and we'd get reimbursed less. Or if it was this or that, I didn't want to know. I wanted to treat each person the same. And so I never allowed my staff to tell me, I'm bragging, I'm just telling you, find a doctor that their concern is your well-being and health, and do the research and make sure that you also combine that with red light. The ideal thing is, let's find out if we have a red light bed near you. Try that practitioner. We have a whole slew of them, and see if that's the person that can guide you in your health and well-being. Remember, we do all kinds of stuff. It's about diet. It's about exercise. It's about red light therapy, obviously. It's not any one thing. If you just did one thing and right and everything else wrong, that's not smart either. And I'm not saying total sacrifice. If someone's in love with dessert, so instead of having it every night, maybe you'll have it once a week, whatever it is, but you just cut back on the things you already know what's not good for you. You've been told a million times. Smoking, coffee, all these different things that people obsess with. Maybe you can cut back with it, get rid of the sugar and things like that. And find that one thing that, I happen to be an expert in weight loss and I can help people with that a lot. And we do that all the time. I don't want to bore everybody here, but I'm going to suggest, if you want to speak to me personally or email me personally, go to the website and just say, you have a question for Dr. Rothschild, and here's the question, blah, 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 and I'll respond. This is what I do all day. I don't see patients any longer. I haven't seen patients for years. I've been too busy with educating and getting involved with making the best equipment. And I love it, absolutely love it. I hope you recognize and understand that we're here for your well-being. That's it.
Doctor, you know what? I can see that. I think everybody else can too. Your enthusiasm is contagious for red light therapy. Thank you so much for being you. And thank you for helping all of those people out there that maybe have given up hope, and you've given them a little bit of a lease on life. Thank you for being you.
My pleasure. Thank you so much for having me on your show.
Thanks, Doc.
Take care.
Thank you for tuning in. Be sure to check back weekly for more exciting episodes. And don't miss Ink and Insight every Wednesday, where we celebrate iconic authors and dive into their impactful works.